Top Med Talk.
Welcome to Top Med Talks to Elizabeth Drum. This piece is presented by Desiree Chappell and Sol Aronson and is taken from some of our coverage of Anesthesiology 2022, the American Society of Anesthesiologists annual conference. Have a listen.
Our guest is Dr. Elizabeth Drum. Dr. Drum is Associate Professor of Clinical Anesthesiology and Critical Care Medicine at the Perelman School of Medicine in the University of Pennsylvania in Philadelphia. Dr. Drum, thank you so much for joining us.
You're welcome. Thank you so much for having me. I really appreciate it.
So for everyone listening, Liz, tell us just a little bit more about yourself.
Well, I'm a pediatric anesthesiologist, so my clinical work is at the Children's Hospital of Philadelphia, which our academic partner is the University of Pennsylvania School of Medicine. So I get to be with amazing colleagues, both in the adult and the pediatric side. I've been at CHOP clinically for about 7 or 8 years, but had a long duration and traveling here and there along the way. Went to medical school in Philadelphia. I did my anesthesia training in Philadelphia. I spent a few years in the Army. So I lived in Georgia, working as an active duty anesthesiologist for several years.
Thank you for your service.
Thank you. Then I went back to Philadelphia. I worked at Temple University for about 10 years. They had a children's hospital, which I was able to help open and start. And then after 10 years, due to politics, money, finances, and the usual kind of craziness, that Temple closed its children's hospital. So I did a few other things for a few years, which is how I ended up detouring into what is really my passion now, global health. And then I went to CHOP, where I'm allowed to keep doing great things there. So
yeah.
So Elizabeth, I'm sorry, you just sort of jumped right into your passion, global health. You got to help us fill those gaps.
Well, I figured you'd ask, so I got to, set the stage. So traveling around the world or helping people in need is something I was always interested in. And as an anesthesiologist, we spend a lot of time caring for other people. So figuring out the populations in my local community where I worked that were in need is something that was a passion of mine. I was always concerned about the rest of the world, but really had no idea how to make any difference. So when I was at Temple and Temple closed its children's hospital, I was kind of in this space where I had to decide what I was going to do next. I was minding my own business one day as life happens, and a friend of mine called me, a pediatric ENT surgeon, and said, I'm going to go to Ethiopia, and I want you to come with me. Like a good surgeon knew that it made no sense for him to go somewhere without his anesthesiologist. So we went with the goal of just seeing what some of the needs were. He was specifically asked to look at some children who had tracheostomies and laryngeal papillomas, which is a consequence of HPV kind of infection. And it's a long story how he got there. But anyway, we went together and decided we were just going to go and look and see is there anything that we or together or collectively could do. We spent the week there, met some interesting people, and came away deciding that we would commit, the two of us, to going twice a year for 5 years to see what we could do to address the educational needs for anesthesia and ENT. We ended up going twice a year for about 10 years, so I've been there about 20 times and was scheduled to go right before COVID hit, so I haven't been back since, but I'm going to get there in a couple months, hopefully. So that's really what started it, and I didn't really know what to expect when I went there. And then that was maybe October of 2009. And a few months later, there was a massive earthquake in Haiti. One of the first earthquakes, there's been a couple since then. And I kept hearing on the news that what they really need was surgeons and anesthesiologists. And I was at this weird in-between space between jobs where I was working a couple part-time jobs and I kind of could make my own schedule. So I went to Haiti for a couple weeks. And pretty soon after the earthquake, I think if I hadn't been in Ethiopia, right before that, I'm not sure I would have been brave enough to go because I don't think I would have known what to expect. But between my experiences in the Army, working in an inner city hospital in Philadelphia, and having been to Ethiopia, I was as prepared as I could be. So anyway, that was really a life-changing experience to kind of be immersed in a place that had such great need, which those two experiences together really helped send me on a trajectory that I had no idea existed and probably wouldn't have had a way to orchestrate it if I wanted to. So
great story. And now you are the committee chair of the ASA's Global Humanitarian Outreach Committee.
Yes.
Can you give us a little bit better understanding of what that is and what that mission is?
Sure. So really before I was an anesthesiologist, Nicholas M. Green, who was the chair at Yale, went to Africa and saw some great need for anesthesia education and training. Ultimately, with the support of the ASA and other foundations, started what was called and still sometimes referred to as the Overseas Teaching Program. So you may have heard people talk about its OTP, and set up an educational program in Africa in a few countries to try to really help address the anesthesia education need there. Those efforts coalesced into what became the Committee on Overseas Teaching Programs, which eventually in about 2010 maybe changed names to the Committee on Global Humanitarian Outreach. And sort of as an aside, those programs have changed locations but still exist, so I can get into that in a minute. And also there's an award every year named in honor of Dr. Green, which is given in conjunction with the Rovenstein Lecture, which will be on Monday, honoring someone who's really committed their life's work to serving others.
And you received that.
Yeah,
I did.
I was just
Yes.
going to say, and you were a recipient.
In 2020, which was the year of no meeting because of COVID. But
yeah.
it was a great honor. And
Yeah.
today I get to present it to an amazing colleague and friend of mine, Dr. Faye Evans. On Monday I present it.
yeah.
Excellent. How
Yeah.
cool.
Yeah.
That
How
is
cool.
very, very cool. Well, tell us about the work that's been done in the past and as chair, where you're really looking forward to going.
The two big things in the past were continuing these overseas teaching programs. Currently, we have two programs, one in Rwanda, which was started, I think, in about 2006, and one in Guyana, which is a little newer. I want to say 2016. I might have the dates a little bit off. And again, they're really aimed at trying to help improve the education and educational infrastructure in these countries. So both of those efforts are a collaborative effort with the Canadian Society of Anesthesiologists. They go by the acronym CASIEF. And so really they're our collaborative partners. And so in Rwanda, for example, the goal originally was to provide enough educational support structure to educate some anesthesia residents. So they had people who were interested. They didn't really have enough clinical instructors. So between the Canadian Society and the ASA committed to sending faculty for like a month at a time to really educate those residents. And now we're at the point in Rwanda where they have almost enough faculty to educate their own residents. But what they really need is some subspecialty education. So we're working on trying to help them with critical care and cardiac and pediatric. And we're also really trying to work with them to help do things like faculty development and recruitment and mentoring and help them figure out how to get to the next level. And it's really, I can't take any credit for it, but it's really amazing to watch how when you empower the local people to educate their own and make systems and that work for them, and we're there to support. You know, they have a very active anesthesia society now, we're the hosts for an all-African anesthesia conference in September in Rwanda. And it's really amazing to watch. And it reminds me that there's so much talent and passion out there. And I really look at my goal is to help people develop their own.
Yeah.
Same program in Guyana. They're a few years behind. They have a few graduated anesthesiologists now, one who's like the head of all the graduate medical education for the government hospital. So COVID kind of threw a monkey wrench into some of it, but we're still continuing those. So those are really the existing two programs that started.
So we have been part of or supportive of the African Perioperative Outcomes Reach.
That's great.
Yes, and that was a big thing for us during COVID. We collected money and we really tried to support Bruce Bickard. And one of the things that I'll never forget just has stuck with me. One, he was talking about, just the research that's going on over there in the country and how, they're really trying to bring everyone together and how it's so difficult because it's disparate and with everything happening on the continent. But the thing that stuck with me the most is that, people want to come in and fix and, give whatever we can from the U.S. and make it like us. Mm-hmm. But it's all about empowering, like you said, to the people.
Anesthesiologists in particular are doers. We want to go in, we want to solve a problem. We don't want to sit around and wait. We don't want to wait for anyone else. We don't even want to wait 2 or 3 minutes for our drugs to work if they could work faster.
Immediate, instant gratification.
Right. And so I think if you're a student of history, it doesn't take too much digging to realize that sometimes doing something is not always the right thing to do. And there's many examples in history of people intervening or thinking that they knew all the answers, which they really didn't. It's a whole sort of emerging topic of decolonializing global health. And so what we used to think, we're going to go here and tell you how to fix your problems or stuff like that doesn't work. It doesn't make any sense. In some ways, it recreates some of the same old, systems of oppression that didn't really work. And so people are really trying hard to figure out how to address that. And, empowering local people to do their own education and support them is, I think, a first step. But
yeah, absolutely.
So Elizabeth, obviously, everything you've done to get you to this place and what you're doing now is laudable without question. I'm sure there's a lot of people who would love to figure out how they can help. In the context of the broader theme of the anthropology of medicine or the culture of medicine, what would you say to our audience how people can participate in a productive, constructive way and help?
Yeah, that's a good question. And it's not an easy one to answer. But I think the first step starts with educating yourself. So listening to talks like this, going to lectures, reading books, listening to other podcasts, and just learning about the history of anesthesia in our country and other countries. There's a lot of resources online on our committee and the work we've done in the history and other things that we're doing. So educate yourself, have an open mind to what may not have worked before and what can work now. Within the ASA and our committee, there are other initiatives that we have that
I was just going to say, talk us through some
support.
of the new ones that are coming out that people can probably get information for.
So there's ways to support work and education financially, even if you can't go. And for some people, that makes more sense. On the ASA's website, you can get a link to the Global Humanitarian Outreach Committee, which you can designate what money might go to, whether it's our overseas teaching programs or some other programs, which I'll get into in a second, or there's many other companies, organizations, nonprofit organizations here at the ASA and around the world. Like Lifebox is one that most anesthesiologists know about, that their mission really is to help improve the safety of surgery and anesthesia around the world. And most people know about it because their pulse oximeter campaign to put them around there, but there's many other things they're working on.
We actually interviewed Alex a couple of years ago.
Oh, you did? Yeah. So, things like surgical site infection and how to prevent it, teamwork. They're working on things like a handheld CO2 monitor, which most of us in the U.S. would refuse to do a case without it, but it doesn't really exist around the world. And headlights, stuff like that. So, and education and training, they're really. So that's just one example. There's other links on our website. There are some ongoing educational programs that sometimes we need people for. So, for example, during COVID, it became obvious that some of our efforts in Rwanda and Guyana, we couldn't physically go there, but providing lectures.
I was going to ask, how does the virtual world work? Because, I know in a lot of countries, they don't even have electricity 24 hours a day, and it's very difficult. I know a lot of countries are tied into internet, and they do have things like that. So how does the virtual world work with this?
Well, it does take planning and organization.
Infrastructure.
So, usually there has to be one specific site at the host, either country or in their hospital or something that has reasonably reliable internet, and you have to, pick a day and time that will work for them. Sometimes you do have to do what we call asynchronous learning.
Yes.
So record a talk and then people there, read it and talk about it. Sometimes you can have synchronous, back and forth. But you're right, places that don't have reliable internet don't always have that. But there's many things that COVID is, I think, forcing us to explore. I think our challenge now is going to be how to keep the momentum of really looking to use that technology and use our ways to communicate instead of falling back on our old habits.
Yeah. So what are you most excited about for the committee in this coming year?
Well, I think the thing I'm most excited about is continuing those educational efforts that we have in place, but also looking at some new ones and some that are kind of helping to open people's minds and eyes. So for the last 10 years or so, we've had a program that we run through the committee where I send CA3 residents to a low-income country for a month to really be embedded in the culture of an educational department in anesthesia in another country to really see what it's like. We started by sending residents to Ethiopia because that's what I was most familiar with. Due to some political instability and some other things, one year we had changed, so now there's other sites that we go to, and we did have to pause during COVID, but to date, probably 50 or 60 trainees have gone to other countries. Many of them now had used that as sort of a springboard to start their own collaborations. an ongoing one in Uganda, some in Kenya and Ethiopia. And so that's one thing that I'm really excited about, and seeing these younger than me anesthesiologists really starting to ask the good questions and figuring out how to put that in part of their career. So that's one thing. We also, through the ASA and the Charitable Foundation, have a program called Global Scholars, where we bring young, upcoming leaders of anesthesia from around the world to the annual meeting. So this meeting itself, we've got 12 global scholars. They're from all over Ethiopia, Kenya, Uganda, Cambodia, Cameroon. There's a few that couldn't get visas in a timely manner. That's a whole nother, bureaucratic issue. But anyway, we have 12 scholars here from around the world, and we have a grant from Edwards Life Sciences to help support bringing them. Up until now, we've only been able to bring a couple, so that grant really allowed us to expand. And they're having an amazing time. If you see them walking around, just to see what this meeting is like. But all of them had a chance to do an observership for a couple days or even longer at a hospital. So several of them went to local hospitals here in Louisiana to really see what it's like for us to practice anesthesia here, and then talk with the two residents about the different programs and really start to develop those relationships, which then can continue. So former global scholars have gone on to become department chairs, influencers in the Minister of Health in their countries. And so those two things are really exciting to me. And then we're trying to figure out what's next. We're in the middle of a process to formally change the name of the committee again, to simplify our name and our mission to just be the Committee on Global Health. And we've really tried to streamline our mission to really say that what we're supporting is education and capacity building around the world, because that's really what we're about.
Well, that's phenomenal.
Think about what new horizons there are.
Yeah, what's over the horizon. We have a multidisciplinary kind of group that listen to Top Med Talk, people from all over the world from different backgrounds. Is there any way that they can get involved or support the initiatives that you guys are doing? Is this mostly for the for the ASA, or?
Well, it is for ASA members. Not that giving money is simple, and not that that's the only answer, but people who aren't anesthesiologists, it's not necessarily that easy to figure out how they could be involved in some educational efforts. But
money is always
money is
really makes it all happen.
It does. So there's that. But for example, several years, some of us have really said to our family and friend, I don't need you to give me any holiday gifts or birthday gifts. Like, make a donation to Lifebox in my honor, or make a donation to the charitable foundation that then we can use for our Global Scholars program. Fantastic. That kind of thing. And talking to your own department, like, would your hospital or your department be willing to sponsor a global scholar? It doesn't just have to be for this meeting. And that would help, start a partnership, some other place or country. And so sometimes friends and family, or people who, in my circle of friends and family who know what I do, like, they're supporting my work, even though they can't go physically do what I do.
Sure. So, I love that. All right, Liz, wrapping up here, please, if people are interested, ASA members specifically are interested, please tell us exactly what we need to do to get to the committee.
The ASA has a website. It's not that easy to navigate, but our committee's website is asahq/charity/about us, I think.
Okay.
But on the ASA website, on the very bottom right, where it says... it's not affiliates. It's
not contacts. Yeah, we'll look it up. We'll make sure to put that in the show notes. So topmedtalk.com, you can find all of these conversations. We'll put everything in the show notes for everyone.
So that's the easiest way on the website.
Great.
And then that shows you all of our information, and there's a contact us and how to be involved.
And so residents, fellows, anyone can come here if they're interested, early career, no matter where they are in their career. And this isn't a committee that you welcome everyone.
Yes. And we have resident committee members. We have people who are close to retirement, and we're really trying to help work with the ASA to say, okay, global health is for everyone from residency to retirement, and there's something there for you. And one of my challenges, and with our committee's challenge, is to figure out exactly that, how to harness people's energy and enthusiasm. And not everybody can or should get on a plane and fly somewhere, but there's a lot of need out there. So how can we make use of people's energy?
That's so wonderful. Liz, thank you so much for all that you do. Thank you for your service to our country. honestly, it's so wonderful to know that people are out there and this is a passion of yours. Global health is important. We can't just support what we're doing here in the U.S. It has to be, it has to be global for everyone to rise up.
And we have plenty of needs here too. So
plenty of needs. We totally do.
Trying to figure that out too.
Yeah.
Right.
Yeah. So again, thank you for sitting down and taking the time with us. I know this is a very busy meeting. If you ever, want to have more conversations about what you're doing or initiatives that you guys are working on, please never hesitate to reach out.
Okay.
And we really appreciate it. So if people want to get a hold of you, are you on social media?
I am. I'm on Twitter at edrum19.
Perfect.
So that's probably the best way. And I don't post that much stuff. I repost other people's things. They have great stuff on there. You can find amazing organizations and people out there, and that's how you can learn more.
That's what I was going to say too. If people want to find links to other organizations and things like that, probably a good resource for that.
Exactly.
Wonderful. Yeah. All right.
Thank you.
Thank you.
Inspirational.
It was very inspirational. Yeah, I love it. Thank you so much for listening to Top Med Talk and watching Top Med Talk here at Anesthesiology 2022. Again, thank you to the ASA, the American Society of Anesthesiologists, for the support to be here and have these fabulous conversations.
Top Med Talk.
Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.